So hi everyone, I'm Dr. Deepti, and in today's video I'm going to talk about how can one approach the upcoming November INICET exam. So approximately 3 months are there for the upcoming INICET exam. So what exactly should be strategy for these 3 months so that we give our best shot for the upcoming INICET? Now, what I would definitely say is that if we look at the current pattern of exams and all of them, right? So, whether it is INICET, whether it is NEET PG, or even if it was the recent FMGE exam, what we see common to all exams is depth of content, right? And that is certainly one thing that has come up unanimously in all exams, right? And when we talk about content, um, the difference between INICET and NEET PG is that INICET will focus on certain topics that they're fond of asking, right? But in those topics, they're going to go into every possible depth, whether it is a factual part of that topic, whether it is memorizing some values of that topic, right? So they will ask, to the depth or to the core of that particular topic. And when we talk about NEET PG, as we have all seen, the variety that they ask is huge. So we need a lot of width, and for the current set of paper, we also need depth, right? So for this particular INICET, what I would recommend as a strategy would be this. So the first thing that I would definitely recommend to anyone who is appearing for the INICET exam is INICET TND. Right now, when we talk about INICET TND, it is a pre-recorded course, right? So it is already available on the app. All tests and videos are already there on the app. And why am I specifying this right now is because, when you have a timeline like 3 months, you want to do certain subjects at a faster pace. Maybe, you feel more confident with them, and maybe some other subjects you need to go into a little more depth, right? So the students can do it at their pace, and therefore all the tests and all the videos would be given or provided to you the moment you enroll for the course, so that you can make your schedules, and accordingly, based on what topics or what subjects you're weak in, you can prioritize on those subjects first, keep the volatile subjects for later part, right? And especially start covering the bigger chunky subjects in the initial part. Right now, before I go on to what you should exactly do with once you are enrolled and how you should use it, let's look at what are the inclusions that will be given to you in this course. So definitely, as I said, you will be getting the INICET test papers as well as the video discussions. And one thing that I want to highlight with our video discussion, especially for INICET, we've seen is that it not only ensures that we are covering PYTs and PYQs, but we also give you the relevant depth for that particular topic. So these videos are concise, crisp, but yet they will give you the necessary content that you need to answer a particular question. Also, the test papers are made by the respective subject faculties, and when they do that, they see a lot of trends in the paper changes, and based on recent and past trends, they do a good amalgamation. So it is like from the horse's mouth about the topics that they feel are absolutely must knows as far as INICET is concerned, right? So every faculty would have contributed a good set of MCQs. So depending on what subject it is, there would be a range of 50 to 75 MCQs, and there would be a range of 6 to 8 hour discussion videos for each test paper, right? Secondly, it would also include PYQ Kabab. So in case you haven't gone through the previous NEET PG papers, which I'm sure you have, you can utilize that as well here. A very important thing which we have seen, again, irrespective of which Indian exam it is, TB and HIV. So this is a comprehensive course which covers all the details that you need to know about tuberculosis, about HIV, and all faculties have come together. For example, I would have talked about PPTCT, right? Or pelvic tuberculosis. Similarly, the pathology teacher would have talked about the pathological aspects, the pharmacology, the PSM, their particular aspects. So it is a very good single point resource where you can cover everything about TB and HIV, and they're absolutely must knows as far as INICET is concerned. Then it would also give you access to DAM's online test series. Now, when I say that, this is important because within the test series, you would specially see not only INICET PYQs as a separate section with their video discussions, right? And you would also see, a wide range of INICET PYQs. So we have questions ranging from the year 2015 until now, which is a good 10-year session of PYQs, which you can practice. And most of the papers from 2018 onwards also come with video discussion. So PYQs are in a separate block. So you can go and see INICET PYQs, and similarly NEET PYQs and FMGE PYQs are all separate, right? So you can just practice the INICET PYQs also while you are preparing for the subject. The second important thing in the test series is GTs. So new GTs will keep coming over this period of time, and you can keep practicing. Not only this, when I say online test series, you would also see a special section here which is called as an INICET mock test papers, right? So this is a section where we have mocks based on only and only INICET pattern, right? And we all know that even the pattern has changed. So we now have 4 different blocks in the paper. So similarly, these mocks would be arranged in blocks for you so that you can practice, and we will be adding more mocks. Anybody who enrolled for the deadly combo for the delay that we gave free over this last 15 days, you would know that we have a separate mock section for NEET PG, a separate mock section for INICET, right? And we keep adding more mocks. So we will do that for you even for INICET, just as we did for you for NEET PG, right? To ensure that you have enough tests to practice, and it should be a different set of questions every time you practice. So the topics remain the same, and that is what you need to understand. PYQs ना बेटा directly बहुत कम आ रहे हैं. What they are asking are more of PYTs, and in that PYT also, as I said, they may go to any depth. So that is why when we practice MCQs in different sections, like in TND or in a GT or in the mock or in PYQs, it ensures that we are covering a wide range of how the questions can be framed. This I'm also saying because as far as INICET is concerned, how they ask questions is different from NEET PG. Please remember that INICET has different types of MCQs. For example, they have match the following questions, which is certainly not been asked in NEET PG, so you need a good practice for that. Secondly, they also ask multiple completion type questions, right? For example, they'll give you 3 statements or 4 statements, 1, 2, 3, 4, and then you have to answer based on which of these are true or false, right? For example, option A would say 1 and 2 are true. Option B would say 1, 2 and 3 are true, and different combinations would be given. So when you get this kind of a question, what does it mean? It looks like a single best answer question, but in reality, it is multiple correct. And unless you don't know all the correct options, you will not be able to mark the answer, right? Or you will mark the wrong answer. So which means the difficulty level goes up, right? Third thing, they also ask reason and assertion questions. अब हर सेशन में रीजन असर्शन क्वेश्चंस नहीं होते हैं, but yes, after every 1 or 2 sessions they keep asking reason assertion. And what do we understand when we say they have RA questions? Now in reason assertion, they're also checking your concept and application of concept, not just whether you have done a rote mugging up or not, right? So you need to know the fact also, but you also need to know the why behind it. So they are actually testing you at various levels, again, which simply means that the difficulty level goes up, right? So yes, all these tests help you to keep on track, because that is what I believe is the single most important thing. We should have both forms of learning, active as well as passive. So while you are giving the test and attending videos, right, it is important that you do a MCQ practice as well, because the real exam is going to be in that format. So we have to ensure we are including content and MCQ skill both in these 3 months of preparation. Yes. Now it also gives you access to DQB GOAT videos. And what is the great thing about DQB GOAT is that, suppose you appear for pathology test and you understand that, oh, my general path is weak. So, what you can do is not go through the entire Q bank, but go only to GPath and listen to the video solutions which are there, especially for the questions that you've done wrong. And that, I believe, helps in content building as well as MCQ skill. Sometimes you've read the entire topic, but still you don't understand why option A is wrong and why B is right? So these short videos that are under the DQB GOAT give you the approach. They teach you how to pick up the keywords, how to integrate, how to understand why the answer is B and not A, instead of just long or very long explanations giving you the entire theory all over again, which defeats the purpose, right? So the idea is the DQB GOAT is also going to help you to improve your MCQ skill. Then the INICET TND would also give you access to short courses. Now the short courses would again include various important things like DVT, and it would also give you access to INIPYT sessions that we did before the May exam, right? Now why am I stressing on these two things? I will talk about it in a little while, but yes, the INITND will also give you access to all these things once you are enrolled into the TD. Now please remember, for the INICET TND, we now will be taking out a 3-month subscription offer. Okay, because as I said, approximately 3 months are left for the exam. So yes, we are launching the 3 months offer also on the INICET TND, and it will be available from tomorrow or maybe today night itself, right? Now, when you enroll for INICET TND, it goes into my courses. So you press enroll, it goes into my courses, and here you will see the videos and the tests. Now, what should be your approach? First thing I would say is start with bulky subjects. Okay, so start with bulky subjects. For example, medicine, surgery, obs and gynae, these are subjects which you are relatively fresh with also from your internship or while you were preparing. So finish off with the bulky subjects first. Then secondly, I would say, as far as the volatile subjects are concerned, especially when I talk about maybe things like biochemistry, some aspects of even anatomy, some aspects of microbiology. So the volatile subjects can be kept towards the later part. Okay. And then I would say, where should you keep SARPO? So I would say, as far as the short subjects are concerned, do them after the bulky subject. So first cover up your bulky subject. So major part is done. You will have significant questions from medicine, surgery, gynae, obs, PSM, pathology, right? So these do contribute a significant number of MCQs. SARPO, what is the good thing about SARPO? SARPO is ki isme na you don't really need to go overboard. So which means just stick to your notes even for bulky subjects, but वो notes भी बड़े होते हैं ना bulky के. SARPO में तो you have just very concise notes, and majority of times you will hardly get any question out of that. So stick to those main notes, which is very, very important, right? ENT Opthal, I would say, the exam tends to be very skewed. So sometimes ENT बहुत ज़्यादा आ जाती है, Opthal कम आ जाती है, कभी कभी Opthal बहुत ज़्यादा आ जाती है और ENT कम आ जाती है, right? So they are again important. Yes. What about first prof subject? So this is the other difference when we talk about INICET and NEET PG. So anatomy, physio, biochem, and even the second prof subjects hold a significantly more weightage, especially in the INICET exams. So, you need to be good with them. And I think most of these subjects do tend to come in our volatile list. And that is why I said do them in the later part, so that for two reasons. One, they are volatile, and two, they are important for INICT, right? So this should be the order. सबसे पहले bulky subjects, उसके बाद I would say go with SARPO, right? Then I would say go with ENT Opthal, and towards the end go with first and second prof subjects, and you can prepare for the test in the similar manner. What time should you take approximately to do these? So if I talk about bulky subjects, I would say a maximum of 7 days, and the range could be 5 to 7 days, right? So we would keep a range of 5 to 7 days for your bulky subjects, because if you keep that, then you're likely to go overboard a little. So if you keep the target as 5, you're likely to go up till 7. 7 should be the upper limit, because if you keep it 7, sometimes you do go and around 10 days as well. So try and keep your target as a maximum of 7 days, right? And even in these subjects, what I would say is, quickly in the first 3 or 4 days, finish your notes. Do a rapid reading of your main notes in the first 3-4 days. Then do PYQs, right? So cover the PYQs and the PYTs, right? So cover PYQs and PYTs, and then in the last one day or last before the test. So what I mean is, for example, let's say you are planning to give the medicine test after 7 days. So in the first 3-4 days, read up your theory in a fast pace, right? In the next 1 or 2 days, try and go through the INI-PYT part. INI-PYT, it is included in your INI-TND in the short courses. So usko dekho, so that उससे आपको आइडिया लगेगा कि पूरे नोट्स में से मोस्ट इंपॉर्टेंट चीजें फॉर INICT क्या है. इस टाइम पे यू कैन ऑल्सो कवर PYQs, एंड लास्ट वन डे जस्ट बिफोर यू अपीयर फॉर योर मेडिसिन टेस्ट, इट इज अ गुड आइडिया टू मेक अ रॉन्ग डायरी, okay, or a diary which can also include your volatile topics from that particular subject, right? So last one day पे उसको concise करने की कोशिश करो, क्योंकि पूरी medicine हम दोबारा नहीं पढ़ पाएंगे, पूरी surgery हम दोबारा नहीं पढ़ पाएंगे, right? So this is how the division should be. Then give your test, which is available to you. Listen to the video discussion, and once you listen to the video discussion, you will again get some topics which you would want to put in your wrong diary or your volatile topic list, because this means that this is something I should read even closer to the exam, right? Then what about subjects which are medium? So for medium length subjects, I would suggest like ENT, Ophthal, Rena, I would say you should finish them in around 3 to 5 days. Okay, so 3 to 5 days. I would also say, preferably don't go beyond 5 days for these subjects. I think it is more than enough. For SARPO, I would say keep a span of around 2 days, right? And for your volatile subjects, again, कुछ सब्जेक्ट्स होते हैं जिनमें आपको और ज़्यादा टाइम लगता है. सो फॉर वॉलेटाइल सब्जेक्ट्स, अगेन आई वुड से maybe yes, you can keep 3 to 5 days per subject for completion, right? So this could be the approximate split up, but the order remains the same. So जो भी आपने दिन decide किए हैं 3 to 5 में से, first 2 days we will do a rapid reading of our notes. Next 1 or 2 day we will do the PYTs which is available to us, and then in the last 1 day before I give the test from the TND part, I will make a volatile copy का list or a wrong diary का list, which I feel कि मैं बार बार भूलती हूँ या मैं बार बार गलत करती हूँ, and therefore I will also read it just before the exam, right? So this is how you should approach the test papers and the video discussions. Then let's look at what new are we getting. So now we are launching a special revision course for the upcoming INICT, and it is the Mission INICT. Right now, what exactly is Mission INICT? Mission INICT will be high yield topic discussion. Yes, so it will be high yield topic discussion, and these would be live sessions. Okay, so these would be live sessions. This is the schedule. for these sessions. We are starting on the 26th with pharmacology. So 26th of August, we start with the first live session on the app, right? So we are going to have this within or on the emedicoz app live. Now, the reason why we want you to do this is, and this is the order we want you to follow. So before 26th, it is a good idea you start finishing up some of the test papers from your TND. And while you are doing that, so that is like your passive active revision. We are going to bring this to you for spaced revision of other subjects. For example, आपने सोचा था कि आप pharma थोड़ी बाद में करोगे, but it's a good idea that we on rotation stay connected to all subjects, and therefore we will have these intermittent live sessions, which is called as Mission INICET sessions, right? And all subjects would be covered. The entire schedule is put up on the app itself. Now, who all will get and who all can enroll for it? So when we talk about Mission INICET, we will, as I said, we will be doing high yielding topic revision, and this will again be based on PYTs and recent paper trends and some things that the faculty feels that you should definitely know as far as INICET is concerned. Okay, now anyone who takes INICET TND will automatically get access to Mission INICET. Anyone who has NEET TND, so anyone who has a currently active course with NEET TND would also get these live sessions within your course itself. You don't have to enroll separately. Third, anyone who has back to basics. So if again you have an active subscription for back to basics, or if you have an active subscription for ultimate app live course, then all these students will automatically get access to Mission INICET, which are live revision programs on emedicoz app. They will be held as per the schedule. The entire schedule is already uploaded, and these will be live sessions at 6 p.m. on the app. We have given you significant gap between these subjects so that in case you want to revise that subject before these live sessions, you can do that. Even if you don't worry, because we would do the revision for you. That is the purpose. एक्टिव पैसिव का एक कॉम्बिनेशन बनाना चाहते हैं हम, जहाँ पे अगर आप अपने पेस पे वीडियोस देख रहे हो तो हमारे साथ आके उसको इंटेंसिफाई करेंगे, राइट? आपकी प्रिपरेशन को विद सम अदर सब्जेक्ट्स गोइंग साइड बाय साइड. सो ये इंश्योर करता है कि हम किसी एक सब्जेक्ट को बहुत लंबा लैग ऑन ना कर रहे हो, बिकॉज देन वी डिविएट फ्रॉम द पाथ, राइट? सो दिस विल बी a super useful revision program for your upcoming INICET. What about other students? So in case you do not have any of these 4 courses, then what should you do? One, I would recommend that you should enroll for INITND, because the moment you enroll that, you get the INI specific test papers, discussions, the entire test series, the mock papers, plus the Mission INICET. But in case you don't want the entire TND and you want to take the Mission INICET separately, you can do that. So on the home page on the emedicoz app, right? So on the home page of emedicoz app, there is a section in the bottom panel which is called as events. So there is an event section in the bottom panel on the home page. You go to events, there you will see Mission INICET separately to be enrolled for. You can enroll from there. The moment you enroll, it will go to my courses, and then you can access it from my courses, right? So you can access it from my courses, and you will be able to see these live sessions on the scheduled date and time, right? So this is the add-on that we are bringing along with INICET TND. Yes. What next should you do? So as I said, this is how it will look like on the events section on emedicoz homepage, from where you can specially enroll for Mission INICET separately, which means in case you do not have, as I said, any of these 4 programs, or you want to take it separately, this is where you can enroll from. Now, please remember, within your INICET TND and even in your NEET TND, you will get access to short courses. Now, this is one section which is brilliant. So, on the app, you will get within your course short courses. Short courses will include DVT, it would include INI-PYT, it would also include the HIV and the TB section, and it would also include a special course called as emergencies. You all know that we have recently launched the book on the emergencies as well, right, which is something which INICT people are very fond of asking. So these four areas, I believe that you should definitely go through if you are approaching the INICT exams on a serious note. Now, a lot of students would ask us, ma'am, DBT even for INICT? I would say yes. And believe me, I've been following the exam pattern trends for a very long time now. Surprisingly, what I have seen in the last 3 or 4 sessions of INICT is that they are asking some old NEET PG MCQs, right? When the NEET PG pattern was a lot of one-liners. So you will agree with me when you go to the PYQs कि INICT वाले suddenly बहुत ज़्यादा one-liners पूछ रहे हैं जो कि बहुत fact-based हैं, right? And एंड टाइम पे उनको कहाँ से रिवाइज किया जाए. सो डीवीटी, द गुड थिंग इज कि डीवीटी की बुक आपने अभी भी करी है, सो यू मस्ट रिफ्रेश इट क्लोजर टू द एग्जाम एंड बिलीव मी इट विल बी यूजफुल, स्पेशली फॉर रिविजन ऑफ things in a shorter span of time close to the exam. So when we are 3 months away, we will do a wholesome preparation where we are going subject wise, we are giving tests, we are building content, we are building MCQ skill. But when you get closer to the exam, let's say last 10 days, last 1 week, then yes, I would say even the DVT would be useful for this kind of a current pattern of exam of INICT, right? And yes, please don't hold a lot of prejudice कि ये INI में नहीं आता है. As I said, they are asking some factual or very unique things which they never asked, but they were previously asked in NEET PG. So yes, there is a lot of cross linking that you would see, just like you saw in NEET PG also, right? We feel that some trends they have picked up from INICT. ओके, पीवाईटी तो ज़रूर करना है. देर इज़ नो, यू विल फाइंड दिस एक्सट्रीमली यूजफुल. और पीवाईटी जो है ना बेटा, वो पहले करना है, right? So while you're preparing for your TND paper in the INICT, go through the PYT also, as I discussed previously. HIV TB course is a must do, and emergencies also. आप सबको पता है INICT is fond of asking emergencies. So this is one section where we have covered all emergencies in one part. You can also purchase the emergency book, the hard copy, from the MediMart section. Okay, so on the home page, if you scroll down, you will see a section on the app which is called as MediMart, right? And on the from the MediMart section, you can take the emergency handbook as well. And yes, it will be useful for covering up your emergency part for INICT, right? To wrap it up, we will definitely have the INI CBT. As of now, the tentative schedule for the CBT or All India CBT is on 15th of October. The registration will close, and 26th of October is the date of the exam. We have set tentative because the government keeps doing something or the other. If they don't, then yes, we will hold it on 26th of October. The registration is open and you can register directly from the emedicoz app itself. The coupon code for CBT is also applicable, right? So you must give CBT exam, because I believe that eventually those few hours where you have to give the exam, you must have a simulated practice in real computer center so that you come across the real problems. इस बार भी नीट पीजी के बाद मैंने देखा बच्चे लिख रहे थे that somebody had a computer problem, somebody had a mouse problem, somebody's screen went blank, somebody had a very hot environment, somebody had no fans working. So all these things no matter how big or small they are, they do affect your performance. So we have to learn to overcome these and maintain our concentration for those hours of the exam so that we give our best for it, right? So do give these simulated CBTs. Now INICET CBT is available separately also and as a combo pack with NEET NEET CBTs as well. But if you want to take INICET CBT separately as of now, yes, it is available and you can enroll directly from the app for it. In case you want to take it as a combo, which means INICET CBT also and NEET CBTs also, that is also available. So you will be able to see the options when you go on the app to enroll for CBTs, right? So these are the things that I feel that one must include in their preparation and how to go about it and how to most importantly utilize the things in the best possible way so that these 3 months we create some positive energy, we create some strength in our content, in our concepts, in our revision, and give the best exam to our ability, right? So if you have any further queries, you can keep writing in the message in the comment section, or you can reach out to us directly. We would be more than happy to help you. So I hope you find this effective, and as far as I am concerned, I think yes, it is a good combination of things that can be used very, very efficiently in these 3 months for your upcoming INICET. Let's take the exam as an opportunity, not as a roadblock. Let's say that it will by giving the exam you may have more options opening up for you, and then you decide what you really want to pursue. Yes, so here is wishing everyone all the best for your NEET PG results, and I'm sure that you will do well. Don't be too worried. Yes, so everyone would have made some mistakes. It is very natural. Even if I sit for the exam, I would have. So let's hope for the best. Irrespective of what happens, one must give the next paper because, as I said, it opens new opportunities and new horizons. So take care, everyone. We'll see you again.